Alright, in this video we're going to cover shock. Shock is going to be chapter 7. The first thing we need to understand is perfusion. What perfusion is enough blood getting to all the tissues. So you have enough blood flow getting to all the tissue. So if there's enough blood flow, there's enough oxygen. Shock, when somebody undergoes shock, there's not enough blood flow. So not enough blood getting to the tissue. And that can happen for any number of reasons. First, let's kind of understand how this would happen. I'm going to kind of simplify this a little bit. We have the pump, we have the pipes, we have the fluid. So the pump is going to be the heart. The pipes are going to be the vessels. This includes arteries and veins, capillaries. Fluid is going to be the blood or the plasma. So the red blood cells making up the solid portion and the plasma being the liquid portion. The vast majority of the plasma is water, or H2O. So something happens to the heart, so if there's some sort of damage or disease that results in damage, you can have cardiogenic shock. What's happening in this case is the heart is not functioning properly, so it's not going to pump properly, and so not enough blood flow is going to get out to the tissue, and so that will cause somebody to go into shock. And this can happen, like I said, as a result of damage, so severe trauma like in a car accident, or disease where you maybe have a clot coming through the coronary artery and blocking that blood supply to the heart. That's a common way. Can cause somebody to go into shock. So with the pipes, typically what's going to happen is you have some sort of dilation occur. So this happens with neurogenic shock, and it also happens with septic shock. So a septic shock is some sort of poisoning of the blood that can occur, or with neurogenic shock, you've had some sort of damage to the spinal column and it's caused the vessels to dilate. They no longer function properly, so they can't constrict and they end up dilating. And when they dilate too much, all the blood will pool in the lower extremity, in the extremities. Sorry, I know that's hard to read. The blood will pool in the lower body, and not enough will return to the heart. So that can happen with neurogenic and septic shock. Then you also have fluid. So we talked about the blood and the plasma, and this can happen as a result of Hypo Bulimic shock. And all that means is low blood volume. There's not enough blood getting around. This typically happens with external or internal bleeding. So this system will kind of go out of control, because what happens is you have the heart, let's say here, and of course it's pumping blood trying to get to the tissues, but it's getting signals that not enough blood's getting out to the tissue, so it starts to speed up because not enough is returning to it, so it speeds up, tries to pump even more out, and so if there is some sort of damage to the artery or veins, it's going to continue to pump it out even faster, and so it kind of goes out of control. It pumps too much out because it starts to speed up because not enough blood is returning to it. So that can be a problem with fluid, with the hypovolemic shock. And you also have something called Vago Syncope, but we'll talk about that a little bit. These are all examples of cardiovascular causes of shock. So these are all cardiovascular causes. So something's happening to the cardiovascular system, either to the pump, to the pipes, or to the fluid. Now let's talk about non-cardiovascular. So in fact, let's go non-cardio down here. And let's talk about respiratory insufficiency. Insufficiency. There we go. Respiratory. That's a P there. I know it's hard to see. Sometimes it's hard to see on this board. Respiratory insufficiency. This can happen as a result of anaphylactic shock. So maybe somebody gets stung by a bee, gets stung, or they eat something they're allergic to, or they come in contact with something they're allergic to. Anaphylactic shock can occur, and essentially what happens, again, this is dealing with dilation or the control of dilation. So the vessels open up and all the blood pools in the lower extremities, not enough gets back to the heart. And it can also cause airways to shut down. So there are forms of anaphylactic shock where airways shut down. And how you're going to treat this, we'll talk about that later. We'll talk about how to care for that in just a second. I don't want to get off the subject. And you also have a psychogenic shock. And this is pretty common. And this is what I was alluding to earlier. You have what's called Vago Syncope. So if you have an extreme scare, like you're really scared, this can happen, or you bump your arm. So you bump your arm and it causes a shock through the central nervous system. That can happen. Vago Syncope can occur. So here's your normal vessel. It'll cause the vessels to dilate, like what happens with other forms of shock. And then let's say here's our person here. Quick little drawing. So here's our person. So normally you have all the blood flowing around, but have a sudden shock occur and all the blood pools down here in the lower extremities. So the easiest way for your body to get you back to normal is to take you from going vertical to laying horizontal. So once you're laying horizontal, it's much easier for the heart to try to pump this back around even when the blood vessels are dilated. So vago syncope, some researchers think it is a survival mechanism we have back from the caveman days. And so if you were being eaten alive, you wouldn't have to experience that. Severe fear or pain could cause vago syncope to occur. It's a form of psychogenic shock, and you wouldn't have to undergo or experience some sort of trauma like that. So let's talk about how to care real quick. Let me move this over. So how do we care for this? And I'm going to give you a real general way to care for most cardio related shock. So cardiovascular related shock. You want to monitor breathing, and of course this will also relate to other forms of shock. You want to monitor breathing. If they're not breathing, you'll CPR. You also want to control bleeding. So if it's external bleeding, you try to control it by applying a pressure bandage. You place the victim on their back. So again, what I talked about going horizontal just makes it easier for it to pump blood around. Place victim on back. If they're having a heart attack, you can put them in a half seated position. So that's for heart attack. Half seated, just it's much more comfortable for loosened clothing. Let me scroll down a little bit, and then 5, if they've got some sort of damage, you can splint the injury. This is not a high priority here. You just don't want them to move around too much and do further damage and cause more damage to the tissue. Here's a big one. Control temperature. This is something your book talks about, but they only really talk about it in terms of somebody getting too hot. Blood is a thermal regulator. It goes out through your limbs and cools. When sweat evaporates, your limbs act like radiators to help cool the blood. And so if you undergo hypovolemic shock, where not enough blood's being pumped around, your body can overheat. But it can also get too cold. So you can have hypothermia or hyperthermia depending on the situation. So depending on the environment, if it's a cold environment, you want to control their temperature by trying to warm them up. If it's a hot environment, you want to try to keep them cool as much as possible. So blood is a thermal regulator, and if you're losing it, you may not be able to control your temperature. Something your book alludes to but doesn't really go into detail, and they really just talk about heat when they should be talking about cold as well. You want to be gentle with the person. So mainly because they may have serious injuries, especially internal injuries that may have resulted. And you definitely want to call 911 with most forms of shock. The only one you might not want to call for is psychogenic shock, where somebody just got scared and fainted, because they're probably going to come back around. But if they're unresponsive for a couple of seconds, you can't bring them back around, then yeah, you definitely want to call 911. But in most cases of psychogenic shock, you may not have to call 911. But definitely anaphylactic shock, cardiogenic shock, anything dealing with the cardiovascular system, you always want to call 911 and get help on its way. And if in doubt, you can always talk to the 911 operator and let them decide. Just tell them your situation, let them kind of decide for you. So that is shock, and I hope that gave you a basic understanding of it, and I will see you in the next video.